Yeah, so, Sally, I'm done with this brat in like 4 days, and then I'll like meet you down in Cancun. Yeah, I think she's got a little bit of like a cold or something. So if I get sick before this trip, I'm gonna be big pissed. Hey, I'm on the phone. She's okay. Drink some water. Sally, I gotta go. I think this kid's dying. Yeah, I'll let you know. Okay, bye. Kid, do you know this doctor's phone number? I can't find Dr. Pepper's number anywhere, bruh. Hey Siri, what's Dr. Pepper's phone number?
I found 5 places.
Thank you! Hi, yeah, doctor. This is Dr. Pepper, right? I think I got a kid dying, and listen, I can't have this kid die on my watch because I'm going to Cancun 4 days. What do I need to do? Okay, yeah, I can bring her in. Yeah, it might be a little bit. Yeah, I'll be there soon. Dr. Pepper?
Hi, how can we help you?
What the hell? I got my sick kid I'm watching. Isabella.
You must be a babysitter who called about the sick child.
Yeah, that's her.
Come on, let's sit down.
All right, you guys gotta hurry. I think she's dying.
She'll be okay, hopefully.
Hopefully.
So since she is coughing, I would like to get a check of her lungs and her respiratory system to see if there's any blockage there.
All right, do what you gotta do.
Breathe through me. Okay. And one more time. Okay. There doesn't seem to be any blockage or any junk inside of her lungs, but it did seem like there were some constricted airways in her upper respiratory system.
Next, we're going to check with the otoscope.
Open wide.
Her throat looks a little swollen.
So is she dying?
No, I don't think that's the case.
So what is it?
In our professional opinion, we think it's croup.
Coop?
Croup. Croup is caused by HPIV 1, 2, and 3 primarily. Most commonly, it causes upper and lower respiratory illnesses in infants and geriatrics, so older people, or those who have weak immune systems. Because of that, we believe that since she is a child, it is indeed croup.
So what do we do now?
Because croup isn't as severe as it sounds, we will not be prescribing any antibiotics to help with the viral infection.
You mean drugs won't fix her?
They would, but it's not necessary since croup generally only lasts for 3 to 5 days and or less than a week.
All right, so she should be good by the time her parents get home, because I got a plane to Cancun in 4 days.
Well, some symptoms include fever, sore throat, and a runny nose, and those are the typical symptoms. And she will have difficulty breathing because of the inflammation in her throat. If you see any progression in those and or new developments, you need to see a doctor.
All right. Anything else?
So we are not prescribing an antibiotic, but we are going to say that when you go home, she should have plenty of warm liquids and sleep.
I think I can do that. You know, these parents are not paying me enough, but just whatever. Nice to meet you, doctors.
Nice to meet you too.
Okay.
Most commonly, human parainfluenza viruses, or HPIV 1, 2, and 3, account for around 80% of croup cases. HPIV causes upper and lower respiratory illnesses in infants, children, and elderly who have a weak immune system. The most common place for viral entry is the nose and the naropharynx. Then it spreads to the larynx and the trachea. HPIV activates chloride secretion and inhibits sodium absorption by the tissue in the trachea, contributing to airway edema. The area impacted is the narrowest part of the pediatric airway, so the swelling that occurs limits airflow. HPIV usually spreads from one infected person to another through coughing, sneezing, close personal contact, and touching surfaces that have HPIV on them, and then touching your nose, mouth, or eyes. This disease can be clinically diagnosed by the coughing and the symptoms alone. The specimen and labs are unnecessary to diagnose the patient.